The Society of Actuaries released a new research report on the connection between oral health and the overall health of children in the United States. The 2000 Surgeon General's report on oral health in America, it referred to dental and oral disease as this silent epidemic due to the absence of symptoms until extreme pain occurs. And children are especially vulnerable to this. They're dependent on their parents or other household members who are helping them implement good oral health practices and to obtain any needed dental care. So in this report, we utilized the data from the 2016 Medical Expenditure Panel Study, a publicly available data set that creates clusters of similar children and their families based on social determinants. And the results focus on those children who might have low dental expenditures but end up having high medical healthcare expenditures. And we wanted to examine any relationship between those expenditures and the lack of prevention activities for children. So Margie, I know this has been a topic that you've been interested in a long time. Why is this topic of specific interest for you?
Yeah, it's something I appreciate the Society of Actuaries support in this and appreciate you doing this video thing about the subject, because I think that oral health doesn't get enough attention among actuaries and among researchers in general. And it's something where I became interested in this really just a few years ago. I have connections at people who work at a community health center in Madison. And I hear about the stories of the children. I hear about the stories of the adults who have oral health issues. And it just got me interested in terms of, could I find any link between oral health and overall health, which hasn't been able to be causally determined, but something that's been able to be, explored. And so I just think it's a good topic to bring to the attention of actuaries and have them consider it in terms of just overall health and expenditures.
Agree. No, it's an important topic to study for the determinants of what happens in public health in general, but obviously in healthcare that insurance and actuaries are associated with. I think sometimes we ask, what's at the core here? What is your basic research question? What's the question that you're trying to get to the bottom of here?
Yeah, so it was an interesting way of going about it. Originally, PhD student of mine here, Solke Yoon, and I are working together on this. And we wanted to really link the overall health and oral health if we could. And the MEPS data, because it's publicly available, is really rich in a lot of things. And we wanted to explore, could we develop some link between oral health and overall health? And it was something where, as a secondary goal, we wanted to look at how many clusters do we need? Because that's just a mechanism in the literature that really hasn't been explored. But it's something where, we specifically wanted to look at children because children become adults. And if we could curb expenditures and keep good oral health for kids, then it would be something that their oral health and overall health as adults would be better. So from a long-term perspective, we think this would increase overall population health.
Yeah, you mentioned this method of clustering, and there's some analytics methods that can be used here. A lot of different ways to look at the data, but I guess expand on why did you use this clustering as a method in your analysis?
Yeah, I became interested in clustering years ago. And finally, I found a few students here who were interested in exploring clustering with me. That's where we ended up going. So we've published a number of papers, one of which was just accepted or published in the North American Actuarial Journal. Another one, hopefully, will be accepted and be published there as well. But I like to look at people as an entire entity, not just pick characteristics. It's not like you can just say it's all about men or it's all about people who are married or all about a person of a single age. And so it's a combination of characteristics. And so clustering, better than regression, is able to actually capture that, similarities between people. And so the way of doing clustering is something that you group similar people together, and those who aren't similar, then you group in different clusters. And so just like any statistical method, how do you decide which clustering method? How do you decide how to decide whether people are similar or not? Those are all questions that we explored in some prior work and kind of extended it to this work as well.
And I think a lot of people will be interested too in the data that you use, this expenditure study. Maybe you can give a little bit more flavor of that data set and what types of information were inside of it.
It's collected publicly by the federal government. And it's something where it started in 1996. There's a yearly study. People are selected for one study called the National Health and Interview Study. And from that, a subsample becomes the Medical Expenditure Panel Study. So they're actually followed for 3 years. It's a longitudinal panel that you could have. And because of that, in this study, we just focused on the cross-sectional aspects. So in every year, there are 2 panels that are going, independent panels. And so we looked at these independent panels, and the kind of data are rich in terms of the only data set that has expenditure data. It's the only data set that has data for the uninsured. And so the data itself can be grossed up so it represents the population. So that's what's nice about our study, is that the results are representative of children between 5 and 17. So great study from a population standpoint, and, from a particular insurer standpoint, they can use their own data. But the nice thing about the MEPS data is that it has a lot of social determinants, very detailed in terms of medical conditions. Things that were introduced in 2016 was a food security file. So you get information about whether a household is secure in food. You get information about their income, their education. And the thing that we exploited in this study was that we wanted to focus on children, but we know, as you mentioned in your introduction, that parents and whomever their guardians are responsible for their care. And so for my children, it would be something where my views on dental care, my views on going for preventive care would probably cross over to my children. Plus, it's a function of my time and my income. And so if I don't have time, then, or money, if I don't have insurance, then how do I, help my children have the best health that they can?
And I guess let's get to some of the results. You did this clustering, you kind of started comparing expenditures on dental and medical. What are some of the key results that you found in the study?
Yeah, so one, with the secondary objective, what we learned was, and I think this is important, that they're overall measures in terms of how to decide on how many clusters to have. And so a lot of the measures would say just have 3. Just have 10. And what we noticed when we explored those, and those results will be in the appendix of the report, what we noticed was you don't spread people out far. If you only have 3 clusters to put people in, you're not going to really get a very diverse set. And so we ended up going to 38, which was what we considered very high. But what it did was it allowed the children to kind of spread out among 38 clusters so that you could actually see what happens when you move from a smaller number of clusters to a larger number of clusters. And in that way, we're able to better dive in terms of seeing where there are issues. And so there were some, and I'm going to cheat and look at some of my notes, but it's like, what we did always in the report was look at the number 1 cluster, which was the highest dental cluster, and it was based on the 75th percentile. And then we compared, in this case, to the 38th cluster, which would be the lowest dental cluster. And so then we looked at ones in between, as you mentioned, the ones with low dental and high medical. And it's like, what we found was the cluster profiles were not always male. They're not always ones with normal weight. There aren't ones with complications or comorbidities. So it's kind of like when you have these scoring models, like we have in risk adjustment, where you get certain points if you're male or normal weight or comorbidities. It's not necessarily true. You could be a male, but not have any issues. And so that's one important takeaway. The other important takeaway is that usually for the children who have higher medical expenditures, they usually don't have preventive care and they don't have orthodontic care. So orthodontic care is also a signal of income and the kind of care. Usually too, the respondent had either poor or fair overall and health status or mental health status. So there's a connection with that mental health status in terms of it. For the household, the highest education and income security and food security, those are all mixed. It's kind of like having lower income, more food insecurity, and less education are going to be more indicative of having some issues. So those are some of the major findings there.
Yeah, and maybe like all good researchers would say, are there any limitations, things to be aware of or to be on the lookout for as this data is used?
Yeah, in any study, it'll be something where you have to worry about your data set. And so in our data set, we are limited. We didn't have things like transportation. We don't have now indicators of rural and urban. So we don't have a good geographical sense. We don't in our study pretend to do anything about causal analysis. So we don't do that. And it is cross-sectional data. So it's not like we're following people over time. But the idea would be is the approach that we've taken with these clustering is that we can now create a cross-sectional study over time to look at trends over time. So the applications of this is actually, broader than what the initial study. And so we have plans to actually extend what we've done.
That's good to hear. I mean, and I guess for people, either yourself in the future or others who are following in your lead footsteps here as they dig further into this, any recommendations or advice or lessons learned from doing this type of analysis?
Yeah, it's something where in any study, you want to be sensitive to your population. You want to be sensitive to, in our data, we have a lot of missing data. And so in other studies, what people do is throw it out. And when you do that, you're actually throwing out a lot of information. So for example, income is missing quite a bit. And if you throw those observations out, what are you throwing out? Why aren't people answering the question on income? Is it that their income is low? And so you would actually be changing the analysis. And so the way we've set up our report and our project is that we've treated variables as categorical and we've added a category for missing. And that way it's like a response. So we're not biasing our results at all. So we're being very clear. So I would advise this idea of censoring or truncating or throwing out data from analysis, that has information. And so you might say it's an outlier, but it might not be. And it's something that could be informative of your results.
Really helpful stuff here, Margie. Many thanks. Big thanks for participating in this project with us. Big thanks also for stopping by to discuss this really important report that examines oral health in U.S. children.
Thank you.
And to those watching this report, really helpful. It's an important read for health actuaries to learn a little bit more about the impact of social determinants of health on oral health, especially in children, and what the impact is on future healthcare. I encourage you to share this video with others in your network, your colleagues. We'll also link them to the research report through this video, which is noted below in the description. Hey, if you have any feedback as well, we certainly welcome that. If you have questions, feedback, just give us an email. Shoot it to research@soa.org. We'd love to hear more feedback and interest in future research projects. You can find this report on the SOA website, soa.org. Simply click on research, then on health, and you'll see it among all the different research reports in that drop-down menu. Thanks for checking in for this another research report from the Society of Actuaries.